Bipolar disorder. Bipolar disorder is a mental health condition characterized by extreme mood swings that include emotional highs, mania or hypomania, and lows, depression. During a manic episode, individuals may feel euphoric, energetic, or irritable, while depressive episodes may involve feelings of sadness, hopelessness, or worthlessness. The exact cause of bipolar disorder is unknown, but it's believed to involve a combination of genetic, biological, and environmental factors. Stressful life events, trauma, and certain medical conditions may also trigger episodes of mania or depression. Treatment for bipolar disorder typically involves a combination of medication, such as mood stabilizers, antipsychotics, or antidepressants, and therapy, such as cognitive behavioral therapy, CBT, or psychoeducation. Lifestyle changes such as maintaining a regular sleep schedule, avoiding alcohol and drugs, and managing stress can also help manage symptoms. If you or someone you know is experiencing symptoms of bipolar disorder, it's essential to seek help from a mental health professional. With the right treatment and support, it's possible to manage bipolar disorder and lead a fulfilling life. Borderline personality disorder, BPD. Borderline personality disorder, BPD, is a mental health disorder characterized by unstable moods, behavior, and relationships. Individuals with BPD may experience intense emotions, have difficulty maintaining stable relationships, and exhibit impulsive or self-destructive behaviors. The exact cause of BPD is unknown, but it's believed to involve a combination of genetic, environmental, and psychological factors. Trauma, neglect, or abuse during childhood may increase the risk of developing BPD later in life. Treatment for BPD typically involves therapy, such as dialectical behavior therapy, DBT, cognitive behavioral therapy, CBT, or schema therapy. Medications such as antidepressants, mood stabilizers, or antipsychotics may also be prescribed to help manage symptoms. If you or someone you know is experiencing symptoms of BPD, it's essential to seek help from a mental health professional. With the right treatment and support, it's possible to manage BPD and improve quality of life. Schizophrenia. Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. Symptoms of schizophrenia may include hallucinations, delusions, disorganized thinking, abnormal motor behavior, and negative symptoms such as reduced emotional expression or social withdrawal. The exact cause of schizophrenia is unknown, but it's believed to involve a combination of genetic, brain chemistry, and environmental factors. Trauma, stress, and drug use may also trigger the onset of schizophrenia in vulnerable individuals. Treatment for schizophrenia typically involves a combination of medication, such as antipsychotics, and therapy, such as cognitive behavioral therapy, CBT, supportive therapy, or social skills training. Early intervention and ongoing treatment can help manage symptoms and improve outcomes for individuals with schizophrenia. If you or someone you know is experiencing symptoms of schizophrenia, it's essential to seek help from a mental health professional. With the right treatment and support, it's possible to manage schizophrenia and lead a fulfilling life. Attention deficit/hyperactivity disorder, ADHD. Attention deficit/hyperactivity disorder, ADHD, is a neurodevelopmental disorder characterized by symptoms of inattention, hyperactivity, and impulsivity. Individuals with ADHD may have difficulty paying attention, staying organized, and controlling their impulses. The exact cause of ADHD is unknown, but it's believed to involve a combination of genetic, environmental, and neurological factors. Factors such as genetics, brain injuries, premature birth, and exposure to environmental toxins may increase the risk of developing ADHD. Treatment for ADHD typically involves a combination of medication, such as stimulants or non-stimulants, and therapy, such as behavioral therapy or parent training. Lifestyle changes such as establishing routines, creating a structured environment, and implementing behavior management strategies can also help manage symptoms. If you or someone you know is experiencing symptoms of ADHD, it's essential to seek help from a mental health professional. With the right treatment and support, it's possible to manage ADHD and improve functioning in daily life. Obsessive-Compulsive Disorder, OCD. Obsessive-Compulsive Disorder, OCD, is a mental health disorder characterized by unwanted, intrusive thoughts, obsessions, and repetitive behaviors or mental acts, compulsions. Individuals with OCD may engage in rituals or routines to alleviate anxiety or prevent perceived harm. The exact cause of OCD is unknown, but it's believed to involve a combination of genetic, neurological, and environmental factors. Trauma, stress, and certain infections may also trigger the onset of OCD in vulnerable individuals. Treatment for OCD typically involves a combination of therapy, such as cognitive behavioral therapy, CBT, or exposure and response prevention, ERP, and medication, such as selective serotonin reuptake inhibitors, SSRIs, or tricyclic antidepressants. Lifestyle changes such as stress management techniques and relaxation exercises can also help manage symptoms. If you or someone you know is experiencing symptoms of OCD, it's essential to seek help from a mental health professional. With the right treatment and support, it's possible to manage OCD and improve quality of life. Post-traumatic stress disorder, PTSD. Post-traumatic stress disorder, PTSD, is a mental health condition that's triggered by a terrifying event, either experiencing it or witnessing it. Symptoms may include flashbacks, nightmares, severe anxiety, and uncontrollable thoughts about the event. The exact cause of PTSD is unknown, but it's believed to involve a combination of genetic, biological, psychological, and environmental factors. Traumatic events such as combat, natural disasters, accidents, or physical or sexual abuse may increase the risk of developing PTSD. Treatment for PTSD typically involves therapy, such as cognitive behavioral therapy, CBT, exposure therapy, or eye movement desensitization and reprocessing, EMDR, and medication, such as antidepressants or anti-anxiety medications. Lifestyle changes such as regular exercise, healthy eating, and stress management techniques can also help manage symptoms. If you or someone you know is experiencing symptoms of PTSD, it's essential to seek help from a mental health professional. With the right treatment and support, it's possible to manage PTSD and improve quality of life. Antisocial personality disorder, APD. Antisocial personality disorder, APD, is a mental health condition characterized by a persistent pattern of disregard for and violation of the rights of others. Individuals with APD may have a reckless disregard for safety, a lack of remorse for harmful actions, and a tendency to manipulate or exploit others for personal gain. The exact cause of APD is unknown, but it's believed to involve a combination of genetic, environmental, and psychological factors. Factors such as genetics, childhood trauma, and a dysfunctional family environment may increase the risk of developing APD. Treatment for APD can be challenging, as individuals with this disorder may be resistant to seeking help and may not see their behavior as problematic. However, therapy, such as cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, or group therapy, may help individuals with APD learn healthier ways of thinking and behaving. If you or someone you know is experiencing symptoms of APD, it's essential to seek help from a mental health professional. With the right treatment and support, it's possible to manage APD and improve functioning in daily life. Autism spectrum disorder, ASD. Autism spectrum disorder, ASD, is a developmental disorder that affects communication, behavior, and social interaction. Symptoms of ASD may vary widely, but they often include difficulty with social communication and interaction, repetitive behaviors, and restricted interests. The exact cause of ASD is unknown, but it's believed to involve a combination of genetic, neurological, and environmental factors. Factors such as genetics, prenatal exposure to certain medications or chemicals, and advanced parental age may increase the risk of developing ASD. Treatment for ASD typically involves a combination of therapy, such as applied behavior analysis, ABA, speech therapy, occupational therapy, and social skills training. Early intervention is key to improving outcomes for individuals with ASD, so it's essential to seek help as soon as possible if you suspect your child may have ASD. If you or someone you know is experiencing symptoms of ASD, it's essential to seek help from a mental health professional. With the right treatment and support, it's possible to manage ASD and improve quality of life. Please like, comment, and subscribe to the channel to receive more videos like this.